1 of my cranial nerve exam. These are basic assessments for the nurse to conduct, but of course there are more thorough ones that can be done. In a normal setting, I don't assess each cranial nerve in order, but for the purpose of this video, we will go 1 through 12. Let's start with cranial nerve 1, the olfactory nerve. This will test the patient's sense of smell. We use a common scent with the eyes closed. This will stimulate memory and recognition of smells in the brain if correctly identified. Cranial nerve 2 is the optic nerve. We assess visual acuity with the Snellen chart while sitting or standing. If they're wearing glasses, we should keep them on. The patient will cover one eye, read the chart, and do the same for the other eye. Have the patient keep the eye covered, looking straight ahead as I assess the visual fields, called confrontation. Repeat this on the other side. Cranial nerve 3, oculomotor, 4, trochlear, and 6, abducens can be assessed together. We shine a light on one pupil at a time to assess equal constriction. I'll have the client focus on my pen light while bringing it closer to the face, called accommodation. And lastly, I will assess the 6 fields of cardinal gaze to check extraocular movements. We will pick back up with cranial nerve 5.